Hi everyone, I'm Dr. Brian Kavara, and before we get started today, I wanted to welcome you to our practice. Now, you've probably just gotten going with your care here, and my goal is to make you feel like you are the most valuable person in my practice. I want every single person here to feel valued and cared for, and so I want to start by just saying thank you for trusting me with your health. I look forward to getting you to where you want to be with your health and allowing you to experience a better quality of life than you even expected. So thanks for taking the time, and we're going to get into some great material here, and I look forward to helping you with your healthcare journey. Okay, so here's what we're going to cover today. We're going to talk about the real power of chiropractic, the 4 Ds that are caused by subluxation, and the potential dangers of poor spinal health. So our first order of business is to talk about health and what it is. How would you define it? Many people come up with different ideas or descriptions of what being healthy is. So let's start with that. The number one answer is feeling good. Now, that is the most common answer I hear when I ask people that question. And that answer, even though I can understand where you're coming from, it can be a little bit misleading because there's a lot of times where you feel good, but your body may not actually be healthy. So feeling good can actually be very misleading. As we see in our 3 images here, the little boy who looks healthy on the outside, eating a good healthy lunch, he doesn't know he's going to have tooth decay in the next few months. And then the woman next to him, she looks healthy, she's happy, sipping on her coffee, just enjoying life. However, she doesn't know that she's got breast cancer brewing in her breast. And on the far right, we have the gentleman who is out for a nice leisurely walk, and he doesn't know that his heart attack is just moments away. So these people, on the exterior look like they're healthy. However, there are things going on inside that are making them not healthy people. The medical definition of health is the condition of an organism or one of its parts in which it performs its vital functions normally or properly. So you see how that definition does not mention feeling good at all. It's all about function. And if our bodies are functioning well, we're going to be absolutely as healthy as we can be. So that is the key thing here, is to remember it's about function, not feeling. So how do we actually assess function is a big question. Now, our bodies are machines. They're very similar to the cars that we drive. However, our cars have lots of sensors and gadgets to tell us when there's problems wrong. We have oil lights, we have engine lights, we have tire gauges. All these things tell us when there's something malfunctioning. However, our bodies don't always do that. They give us symptoms, which are actually the last thing that actually comes on. So when you do start to get symptoms, that's really at a point where it's probably too late and the problem has been festering for quite a bit longer than that. So the best person to assess how you're actually feeling and functioning is you. You're the one that knows best because you know your body better than anybody else. So when your body is telling you something's wrong or you feel like you're just off, that is a good indicator that something's probably brewing in there and it's time to get that checked out. The human body is an amazing machine. It is designed to heal itself. So that's one of the most amazing attributes we have as functioning human beings, is if we have an injury or if we get a cut or we have anything that damages our bodies, the body naturally wants to heal itself. And so if you were to cut yourself, you don't have to necessarily take things. Your body's going to naturally start to form a wound over that injury and start to heal. So this term of the body's ability to heal itself was actually brought to chiropractic by the founder of chiropractic, whose name is Daniel David Palmer, or D.D. Palmer, and he called it innate intelligence. That means it's internal. It's something your body does naturally on its own. And it's able to do that by a functioning nervous system. Now, how the spine can impact that is through something called subluxation, which we will talk about more. So how do our bodies know when something is malfunctioning? We have a really intricate system in our bodies called the nervous system. And this is composed of our brain, our spinal cord, and all the nerves in your body. And those nerves communicate back and forth between your brain and your body, and it controls every function that takes place. Now, our brains would be comparable to the CPU of your computer network, or the server, if you will. And we have all of the different organ systems in our body, which would be the different little network computers. So you have the main hub, which is your brain, and that controls how every other system functions through those nerves. Now, in our picture here, you can see how the pathways of these different nerves extend from the central part, which is the brain and the spinal cord again. So you have these nerves expanding out from the center. And what do you suppose it is that protects that central part? That is our spine. That's why it's so important to have a well-aligned spine to make sure all those nerves in your body are functioning at their absolute capacity. So as a chiropractor, I'm taught to analyze your spine for something called subluxation. And that is when the bones move out of their natural alignment and start to put pressure on the nerves. And anywhere that that nerve goes, now you're going to have changes to how that part of the body is working and functioning. So what types of things can cause a subluxation? There are many types of traumas that can cause subluxation. Traumas can be big, like a car accident or a fall or sports injuries. They can also be micro traumas, little things you do day after day after day. Could be sitting at a computer or something you're doing repetitively throughout the day that causes stress to the body, which moves the spine out of alignment. So a subluxation, or bone out of place, can cause any of the 4 Ds. That would be discomfort, dysfunction, disease, or degeneration, or it can be a combination of all of those. Now, most people can understand the discomfort or the degeneration part of subluxation, but oftentimes people don't think about the disease or the dysfunction. And those are definitely the silent killers of a chiropractic subluxation. So a subluxation to a part of the body will cause dysfunction and eventually disease to set in. And as we see here, if you have a well-functioning nerve going to your heart, we have normal blood flow in the body, we have a healthy heart rate, and that part of the body or that heart is functioning at its ability, its peak ability. So if we look at a subluxation to the upper part of the thoracic spine or the upper back, those nerves go to the heart and to the lungs. And so if you have a subluxation there, we know that that part of your body is not going to be functioning the way that it should be. And so that could manifest as heart rate problems or high blood pressure, low blood pressure. It can affect a lot of different aspects of that heart function. Now, if we go to another region of the spine, this is called the cervical or the neck region. Now, those nerves go up into the eyes, ears, nose, and head. And so the more common issues that we can see with that would be sinus problems or allergies, runny nose, stuffy head, headaches. All those can be potential symptoms of a subluxation to the upper part of the neck, because that's where those nerves go. And we know if there's subluxation there, it's going to cause pressure to that nerve and eventually lead to decrease in function. Now, you may have heard of someone that has suffered with asthma and been treated by a chiropractor. And that's because those same areas of the body which go to the heart, like I said, go to the lungs. And so the common problems there would be difficulty taking a deep breath, or shortness of breath, loss of breath, difficulty breathing. Those can all be potential problems when you have that same area of subluxation to the upper part of your upper back. Now, one of the most common problems I see in my practice, and this has a lot to do with, I believe, the people that are using computers more and more nowadays, is they develop problems between the shoulder blades, and those nerves go to the stomach. So a really common question that I ask people when I find a subluxation there is, are you having heartburn? Are you having indigestion? Because those nerves go to the stomach, and that's a really common symptom to see when you have a subluxation in that upper back area between the shoulder blades. Now, when we move down to the lower part of the spine or the lumbar region, the lower back, those nerves, they control how we digest foods, how we eliminate things, and the reproductive systems. So getting into the upper part of the lumbar spine, we see the nerves going to the intestinal tract, so that can affect how we digest and process and eliminate the food. So constipation, bloating, diarrhea, they can all be symptoms that you can experience when you have subluxation in that part of your spine. And then finally, towards the very bottom of our spine, we have the nerves going to the reproductive system. So for ladies, this could be menstrual cycles, it could be irregularity, it could be painful periods, and for men, it could be prostate or reproductive problems. So again, if there's subluxation down in those areas, those parts of the body, those systems are not going to be functioning at their absolute best. So I wanted to share with you a really interesting study that was done way back in the early 1920s by a doctor named Dr. Windsor. And he was a medical doctor who performed autopsies on a number of different patients. And they determined those patients that had pinched nerves also suffered organ problems to wherever that nerve was going. And the more severe or serious the pinched nerve, the more severe or serious the organ dysfunction was. So that leads us to two great thinkers who were well before their time. The first is Hippocrates, who is considered the father of medicine. And look what he said. He said, look well to the spine for the cause of disease. And then we have Thomas Edison, who was one of the most famous American inventors of our time. And he mentioned that the doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease. So again, nowhere in there does it say anything about symptoms or how we're feeling. It's all about how we're functioning, and that function centers from how healthy the spine is and how healthy our nervous system is as a result of that. So what are the potential dangers of a subluxation if it's left untreated or uncorrected? And we see the several terms here, which you've probably heard of some of these, and you can associate it as spinal decay, degenerative disc disease, bone spurs, osteoarthritis. These are all common terms that describe the degenerative changes or the breaking down of the bone in the joints. So there are very similar parallels between chiropractic care and dentistry, because we're the two professions that deal specifically with bones. Now, if you talk about dental hygiene, what do you do if the dentist finds a cavity? When should you treat dental problems? At what age did you start seeing a dentist? How often should you brush or floss? When will you stop caring for your teeth? And when will you stop seeing the dentist? So now let's talk about spinal hygiene. At what age did you start seeing a chiropractor? Do you have regular spinal checkups for subluxations? How often should you stretch your neck and back? When should you stop caring for your posture? When will you stop caring for your spine? And when will you stop seeing your chiropractor? So you may be wondering, if you have a subluxation, how long does it take for degeneration to start to set in? And as we can see in this image here, we have the picture on the left was the same individual at age 27, and in only 8 years, we see a much greater loss of space in between the bones and some roughening of those edges of the bones as well. So it advances fairly quickly once that problem is there. And so that's why it is so important to correct these problems before they develop into bigger ones. Another very common question I get asked is, well, is it normal for my age? And I would say it's very common for your age. And there's a difference between common and normal. So common means that it can happen to a lot of people based on the things we do for work and play. So if we're involved in different activities that create stress or traumas, it's very likely. However, it is not normal. And so if somebody walked into my office with a spine like the person on the right and they were in their 60s, even though it's common for people that age to have problems, I wouldn't say that that person is abnormal because they have a healthy spine. They're just maybe uncommon, right? So the purpose of a chiropractic adjustment is to put the bone back in place, which relieves pressure to the nerve, decreases pain, restores function, and most importantly, it restores life. Now, our main purpose here at Living Well is to help you help your body heal. So everything that we do is about movement and getting your body moving so we can get you back to enjoying life. And so that's our main purpose and goal, is to get you out and doing the things that you want to be doing, and more importantly, allow you to heal from the inside out. Now, this is a slide that's very near and dear to me. This is pictures of me with my family. And as you can see, we have just a great, beautiful family. I'm very blessed with two great daughters and a great son and a beautiful wife. And they're blessed too because they have a husband and a dad who's a chiropractor. So they've been fortunate enough to have chiropractic care from an early age. And so they've been able to experience the benefits of having their spine checked from the very beginning of their lives. For my kids, and my wife gets to have her spine checked regularly now. So that said, if you think about how we compare our time with going to the dentist on a regular basis, we all have our family dentist, and we go in every couple of months. Sometimes it's 6 months, sometimes it's 3 months to have our teeth checked. We have a family doctor that checks us annually, or even more often if there's things that they're keeping eyes on. So we have a family doctor that we go to for those regular checkups. But why don't we have a family chiropractor? That's a big question that I get asked. And so I want to extend out an opportunity for you to invite your friends and family in for a checkup. And so at the bottom of your form, you'll notice that there's a question that says, would you like to share the gift of health with your friends and your family? And we have these wonderful cards that will allow them to experience their initial office visit, so their exam and their x-rays, as well as the report of findings, just like you did. And there's no charge for them, just because you took the time to watch this video and you gave them that card. Now, if they bring that card in, there will be a special gift for you as well. So just let us know if you have a family member or a friend that you think could benefit from a chiropractic screening, and we will get you as many cards as you'd like. Okay, if you haven't already done so, now's the time to take out your answer sheet and answer the questions so you can earn that $20 gift card just for taking the time to enjoy this video and hopefully learn lots of useful information. So I just want to say thank you for taking the time to watch this video. I hope you found the information to be valuable and to expand your knowledge of what chiropractic is and the beauty of having a well-aligned spine and how it can allow your body to work at its absolute best. So thanks again for taking your time to enjoy this presentation, and I look forward to seeing you in the office.